Hi, I'm Dr. Michael Sundine, a board-certified plastic surgeon practicing out of Newport Beach in Costa Mesa, California. I'd like to talk with you about one of my favorite procedures in an area of great interest of mine, and that is the area of face and neck lifting. Face and neck lifting has been a long-held interest for me, in fact so much so that I performed extra training in facial rejuvenation surgery and have presented papers nationally and internationally regarding facelifting. Well, who's a candidate for a facelift? Our typical patients, somewhere between 45 to 65, depending on whether it's a primary or a secondary facelift. The anatomic changes they notice is they start to get a hardness over their cheeks because the tissues have seemed to fall off their cheekbones. The crease here is deepening as things fall down and hit that nasolabial crease. They develop jowls and marionette lines as, again, these tissues fall towards the center and down that accentuate that. And we go from that nice heart-shaped face of youth to a more boxy and angular and harsher appearing face as we get older. There are also changes in your neck with bands that develop in the muscles in the neck and frequently a double chin appearance of the neck with fat accumulations and so on. So our goal with facial rejuvenation surgery and face and neck lifting is to really return that patient to where they were 15 years ago. We don't want to do that, make them look unnatural. We don't like these tight skin facelifts that make people look windblown and have this drawn appearance. Our result is a harmonious, rejuvenated appearance without stigmata of facelifting. We hide our incisions very nicely so they're not noticeable. We don't over-tighten the face to produce a natural looking result. And that's our goal, is the most natural looking facelift so that patients are not observed by their friends to be any different. They just look better, they look more rested, they look more youthful. The procedure is done on an outpatient basis. We like our patients to stay overnight in an aftercare facility so they can be carefully observed. We're very rigorous about the activities that they can do for the first 10 days post-op, and after that pretty much things get loosened up and they can increase their activities. By about 7 days generally there isn't much bruising or swelling going on. Usually the swelling that you see in the first day post-operatively is about as bad as it's going to get. Pretty much patients can anticipate about 2 weeks of downtime before they can start to resume normal activities, and they can really get back to their full activities around 3 weeks post-op. If this is a procedure that sounds of interest to you, please don't hesitate to give our office a call, and I look forward to meeting you.